Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over how to determine if your patient has an abnormal electrical axis. It is so simple, and if you haven't watched our video on how to determine the normal electrical axis, please do so now so that this video will become so easy to understand for you. Okay, so we know from our previous video that the normal electrical axis of the heart is between -30 and +90 degrees. So how do we know if our heart has an axis to the left, in the left quadrant, that we call left axis deviation, or if it has an axis to the right, which we call right axis deviation? Well, all we have to do is use our same little trick, but we'll add one more additional step. So remember that the QRS complex shown here represents ventricular depolarization. So what I've done is I've drawn 3 circles, right? And I call this the 3-circle system. And basically, these circles represent lead 1, AVF, and 2. So we know that lead 1 sits here at 0 degrees. We know that lead AVF sits here at 90 degrees. And we know that lead 2 sits at 60 degrees. So we know that these are the positive ends of the leads. So imagine them like little eyeballs that are looking from 0 degrees, right? Lead 1, we know that AVF is looking from 90 degrees, and we know that lead 2 is looking from 60 degrees. Okay, so our QRS complex we know is like a pretty girl, and if the QRS is headed toward our lead 1 for most of the time, then lead 1 will be mostly positive or mostly happy. So basically, if our QRS complex is mostly positive in lead 1, it means that our ventricular electrical activity is mostly pointed toward lead 1 or pointed leftward. Okay, so what just happened? We look at lead 1 on our EKG, and we see that it is mostly positive. If it is mostly positive, we say that it is headed toward lead 1 or in a leftward direction. So we know that it is not pointed over here, right? We know it must be pointed leftward. Okay, so let's look at AVF. Is AVF mostly positive? Yes. Then our axis must be pointed downward toward AVF as well. So we know it can't be up here. Okay, so this is the normal electrical axis. This is what we went over in the previous video. But what happens if we have this situation? So our QRS is mostly positive in lead 1. Okay, so we are headed leftward. It can't be over here. But our AVF is mostly negative. This means that it has to be pointed upward. It can't be down here. So is this left axis deviation? Well, not so fast. Remember that I told you that the normal electrical axis is anywhere from -30 to 90 degrees. So all we know right now is that the axis is headed upwards and leftwards. It could be pointed anywhere from 0 degrees to -90 degrees. So how do we determine if it is in that bad left quadrant, or how do we determine if it is between -30 and -90 degrees? So all we have to do is we have to look at lead 2. We have to do the same thing that we've been doing. So we need to know that lead 2 is located here, okay? We know that if the axis is pointed anywhere from -30 to +150, it is going to show up as a positive in lead 2, right? So we know that lead 2 is 60 degrees, so we know that half of our 360-degree circle is 180 degrees. So if it's headed toward anywhere from +90, +90, right, it's going to be a positive in lead 2. So any QRS that is positive in lead 2 will head in this downward and leftward direction. So what do? We look at lead 2 on our EKG, and we see that it is mostly positive. So we know that the electrical axis must be headed toward lead 2. In other words, we know that the axis points between -30 and 150, right? -30 and 150. So we know that it can't possibly be in the left quadrant. So let's put it all together. If we have a mostly positive QRS in lead 1, we know that it's headed leftward. We know that if we have a negative QRS in AVF, we know that it must be pointed upwards. And if we have a positive QRS in lead 2, then we know that the axis is pointing between -30 and 150. So when we combine all of these vectors together, we see that it is pointing leftward and upward, but it is between -30 and 150. So this axis is actually normal. It's this little sliver right here. So don't let this trip you up. Now, what if I gave you the following scenario? If you have a positive QRS in lead 1, right? So we know that we're headed leftward. It can't be over here because we're headed this way. Okay, and we have a negative in AVF. And you have a negative QRS in lead 2. We know that a positive QRS in lead 1 means that the axis is pointing leftward. Okay, we know that a negative QRS in AVF means that the axis is pointing upward, so it can't be down here. And we also know that a negative QRS in lead 2 means that it is pointed away from -30 and +150 degrees. So we know that it can't be in the little sliver here. So what do we have when we put this all together? We have an axis that is pointing leftwards and upwards, and we know that it is pointing away from our -30 to +150 degrees. So aka the axis is pointing between -30 and -90 degrees. This is left axis deviation, which is abnormal. So let's say I give you this situation. Okay, you have a mostly negative QRS complex in lead 1. Okay, and you have a mostly positive QRS complex in lead AVF. Well, we know that it is headed away from lead 1, so we know that it is headed toward the right. We know that it's headed this way. It is also headed toward AVF, so it is headed downward, right? It can't possibly be in this section either. So we have a rightward and downward axis. This means that it must be in the right quadrant. So we have right axis deviation, which is abnormal. So lastly, what if I gave you a mostly negative QRS in lead 1 and a mostly negative QRS in AVF? Well, we know that the axis points away from lead 1, right? And we know that it points away from AVF. So any axis that is pointed rightwards and upwards is considered a far right axis deviation. This is also abnormal. So we know if it is pointing away from 1, and we know if it's pointing away from AVF, then we know it is far right axis deviation. So in summary, what have we learned today? The normal electrical axis is between -30 and +90 degrees. And we can use leads 1, AVF, and 2 to determine right and left axis deviation. Specifically, we know that left axis deviation will have a positive QRS in lead 1, a negative QRS in AVF, and a negative QRS in lead 2. This will give us left axis deviation. We know that right axis deviation will have a negative QRS in lead 1, a positive QRS in AVF, and lastly, far right axis deviation will have a negative QRS in lead 1 and a negative QRS in AVF. So as always, I hope you found this video useful, and be sure to check out our channel for more content, and be sure to like and subscribe.